So we're at the South. We're at South Kaiser, South Sacramento Kaiser in South Sacramento, and this is Nurse Vivian Camillo. Okay.
So this is where I work, and I work in the peri clinic, and this area here is our clinic area. We have on this side of the building is all the doctors, psychologists, offices, and then on this side it's patient exam rooms.
Okay.
So here is our procedure area.
Okay.
That's the entrance. Um,
Can we go in?
yeah. And this is all the patient with our patients. We prep our patients and also we cover our patients in this area. This is where the nurses sit.
Oh, okay.
And then we have 2 exam rooms right now. We'll probably have a third one in the future, but for now it's 2 exam rooms where we do all our procedures. We have what we call a C-arm to, because we work on the spine. And so, you can't see that from the outside, so you need x-ray to guide your placement of your needles.
Oh.
Yes, patients go here, and then the doctor is right here doing the procedure. This is his table. And then me as the nurse, I would monitor the patient's vital signs here.
Oh, so you would be standing over here, then the doctor would be here.
He's sitting in this corner charting,
Oh.
looking at the vital signs,
Wow.
and then getting my medications out of there.
So how many patients do you deal with every day?
On average, I would say 20 to 25 patients.
25 patients?
Yeah.
Oh.
On a really busy day, it could even go up to 30, over 30, but average, I would say probably 20.
20?
Mm-hmm. For 2 procedure rooms, which is not bad if you think it's 10 patients per procedure room, and it's not busy.
So you work hand in hand with physical therapy?
We just refer patients to physical therapy,
Oh.
and then they kind of take over, and then they assess the patient, and then they figure out what kind of exercises will work for the patient. Teach them. This is their office. Help them out with, and then this is our gym with exercises. Oh, I guess they're doing exercise right now.
Oh, I don't know if I could.
Yeah, so we can't go in there.
Yeah.
And then besides physical, so we have psychologists, physical therapy, then we have the anesthesiologist who sees the patient and helps with their medication management and do procedures for them. So we take care of all of that.
So what do you usually do when you check out a patient, I guess?
Check in a patient for a procedure?
Yeah.
So first I have to go over to our reception area and then pick up the patient, bring the patient back here, have the patient change into one of our gowns, and then, so everything needs to come off except their underwear and socks, put the gown on, and then we have them lay down here. First thing I do is always check their ID band, make sure everything is correct there as far as their first name, last name, date of birth, and medical record number. That's very important. And you also check it against the consent. Every time we do procedures anywhere in the hospital, you always have to get consent. And then we bring the patient into our procedure room and do the doctor does the procedure, and then they come back. We bring them back out here after the procedure, and they stay anywhere from 15 to 20 minutes. We monitor their blood pressure, everything, pulse, oxygen, respiration for another 15-20 minutes, and their pain level. We always chart a pain level with every vital signs. And then after that, if everything is fine, and then we check the site to make sure that there's no, the puncture site. We usually go either in the neck or the low back and make sure that there's no bleeding from that side, or there's no discharge or any kind of signs of infection or any. You wouldn't get infection right away. Sometimes it takes 24 hours. But anything abnormal, you just want to check the site. Want to make sure that they have feeling in their legs and that they can stand up on their own before you have them get dressed. And so if everything is fine, then you have them get dressed, and then we give them their discharge instructions, and then they go home.
So what college did you go to and what was your major?
Okay, I went to San Jose State University, and my major was nursing.
Did you just think, oh, I'll just choose nursing?
No, yeah, I knew you were gonna ask this question, and I was like trying to think of some really cool answer to give you. But the truth is, I really didn't know what I wanted to take in college,
Yeah.
and then the only reason why I went into nursing is because my best friend in college was signing up for nursing, so I followed her and I
Oh.
signed up for nursing.
So how long were you in school for? From bachelor's and for your master's?
For bachelor's, I stayed 5 years only because when I tried to apply for the nursing program during the time. I mean, nursing was really a popular program, so I was delayed. I was so impacted. I was delayed for a year. I couldn't get into the program.
Oh, so it was impacted back then too?
It was impacted
Wow.
back then too.
So how long have you been a nurse?
Well, since 1989.
Oh, yeah, that's pretty
But
long.
yeah, but actually I got my degree a year before graduation because at that time we were allowed to take I'm sorry, not my degree but my license, because we were allowed to take the the exam for the board, um, state boards, even before graduation. So I had my license a year before I graduated.
Describe your roles as a nurse at Kaiser.
Advocate, or it's more than just a patient advocate. It's more like you're you're the patient. I really don't know how to explain it. It's just like, um, you know how we kind of, when we, it's like when they come in for procedures or they come in for even just a clinic visit, and then you assess the patient. Just from the assessment alone and from the vital signs, if you could pick up a lot. If so, you're the eyes and the ears of the doctor, and then you just kind of you have to alert them if there's anything out of the norm. And
So what's the purpose and function of this particular facility?
okay, so a big thing here, since we do procedures, is the timeout, and so you have to make sure that you follow the rules there as far as checking patient name, date of birth, medical record number, making sure that everybody involved in the procedures in the room, and that you all agree and that the patient agrees on the procedure that you're doing on the patient, correct? If there's just everything's correct.
So how is this job rewarding?
I say it's rewarding when you feel like when patients, because chronic pain patients, you see them all the time, and they come and they're happy to see you. They feel like you help them during that, even though you can't take away their pain, but when they're happy, and then they're very appreciative and they're happy to see you because you helped them the last time, so that's a good thing.
Okay. Well, thank you, Nurse Camillo, for your time and just showing us around the pain clinic.
You're welcome. We have a very good program because, like I said, everything is here. Once you're a patient here, um, and you're admitted here, everything is, we just take care of it. We have physical therapy, psychologists, the anesthesiologist, um, just everybody working together. Like, um, they all know the patient. Like, if you are a patient here, the doctor knows exactly what's going on with you and the psychologist, because they talk, and the psychologist and the doctor and the physical therapy are all talking. So they all have like one common goal, that is to help you manage your chronic pain.
Okay. Does the government set rules and regulations that you have to follow?